Imagine the worst. Your father is having a heart attack.
Medic 7 for chest pain.
Your baby can't breathe. Your wife is in premature labor and needs help now. Will help come in time? If you live in King County, you're lucky. King County has one of the finest emergency response systems in the nation. Plus, one of the best survival rates for cardiac arrest patients, 46% compared to about 5% for other major metropolitan areas.
Not everybody can be a survivor, but if there's somebody that can be a survivor, they'll survive here in the county.
Why? Success is due in part to the focus on what really works, combining professional training and constant research to check best practices.
Well, I think it's a lot of skill, a lot of dedicated professional, a little bit of luck, but for the most part, the medical model that we use here insists upon a data-driven, research-driven, factual reason for doing what we do.
Engine 34, Medic 6 in place of Medic 11 for a baby short of breath.
Over 160,000 medical calls are answered every year in King County. Public Health Seattle and King County oversees the entire EMS system. The network is made up of 5 dispatch centers, 6 paramedic provider groups, and emergency medical technicians, also known as EMTs. The EMTs are located throughout the county at 30 different fire departments. EMTs are dispatched to provide basic life support. They're usually firefighters with special EMT medical training and often are the first on the scene.
Once we get on scene, our priority as the firefighters and the basic EMTs on scene are the ABCs. We're looking for that airway, their breathing, the circulation, stopping any bleeding that may be present, and then preparing the patient to be treated by the paramedics at advanced level.
Because EMTs handle less serious calls, paramedics have more time for advanced life support.
A cardiac arrest or a heart attack, certain types of respiratory illnesses such as asthma or difficulty breathing from congestive heart failure. The types of calls where if somebody doesn't do some specific intervention in just the right way at just the right time, you're probably not going to survive.
If you need advanced life support, your survival often depends on the level of medical care you receive. Public Health Seattle King County oversees Medic 1 in the south part of the county. They are among the most skilled and best trained medics in the country.
They spend from day one time in the field working under the supervision of senior paramedics. They spend time in the hospital working under the supervision of physicians and nurses to gain that critical experience.
It's very much a medical profession for us. This is all we are trained to do.
Alan, my name's Aaron. I'm one of the paramedics here for King County Medic 1. This is my partner James. We're gonna help you out today, okay? Okay. If you're somebody who can take charge, be compassionate, and have a broad spectrum of knowledge and not be rattled, be able to think outside of the box a lot. Okay, Alan, what I'm seeing is that you are indeed having a heart attack. Your calls change from minute to minute, from hour to hour. So you can't be somebody who's rattled very easily.
You have to have a love for the job, for medicine, and for the public that we serve. I mean, if you can't love all of those things and find balance with all of them, it would be very hard to do this job.
Paramedics and EMTs in King County handle thousands of emergency calls every year. It's expertise and service you can count on. With your help, we save lives every day.
Our paramedic system is successful because the citizen, the dispatcher, the EMT firefighter, and the emergency physician group at the local hospitals provide that support that enable the paramedics to be so successful.
Don't worry, we here at King County Medic 1 are going to take good care of you.
Thank you.
To learn more about EMS in King County and how you can get CPR training, visit kingcounty.gov/health/EMS.